Welcome to the #1 N-Klex prep map, where future nurses transform into confident, critical thinkers. If you're tired of cramming and forgetting, and ready to truly master nursing concepts, you're in the right place. Today, we're diving into powerful, evidence-based study strategies that will help you retain information, think like a nurse, and excel in both nursing school and the N-Klex exam. Let's get started on the path to success. Mastering nursing education. Developing effective study strategies over cramming. Believe me, this is a game changer, not just a talk. Nursing is not just about passing exams, it's about saving lives. But how do you prepare for a profession that demands both knowledge and critical thinking? Too many students rely on last-minute cramming, hoping to retain just enough to pass the test. But here's the truth: cramming is a short-term fix for a long-term career. Today, we're going to explore how you can develop strong study strategies that will not only help you excel in nursing school but also prepare you to think like a nurse in real-world practice. Cramming may seem like a quick solution, but research in neuroscience and cognitive psychology shows that it leads to shallow learning, meaning you forget most of what you studied within days. Studies from the National Council of State Boards of Nursing, NCSBN, and learning experts highlight that deep learning, where you actively engage with material over time, is the key to long-term retention and application. 1. Why cramming doesn't work? Because it is. Overloads short-term memory, lacks active engagement with concepts, prevents deep understanding needed for clinical decision-making. Nursing exams, including the N-Klex, are designed to test critical thinking, not just memorization. So, let's talk about how to build study habits that work. Keycap 2. Develop a strong study strategy for nursing school. Instead of last-minute cramming, focus on structured, strategic learning methods that reinforce understanding. Here's how. Use the active learning approach. Teach it, don't just read it. The best way to know if you understand something is to explain it to someone else. Studies show that teaching concepts enhances retention by 90% compared to passive reading. Small diamond. Ask, why? Not just, what? Nursing isn't about regurgitating facts, it's about application. Instead of memorizing lab values, ask, what does this tell me about my patient's condition? Apply the concept clinically, use case studies, practice N-Klex-style questions, and patient scenarios to connect theory to practice. Implement spaced repetition for retention. Spaced repetition is a scientifically proven method to retain information long-term. Instead of rereading your notes all at once, review key concepts over days or weeks in short intervals. Study a topic today, right-pointing arrow. Review it in 2 days, right-pointing arrow again in a week, right-pointing arrow once more in a month. Use flashcards, like Anki or Quizlet, for pharmacology, diseases, and lab values. Repeat N-Klex-style practice questions with rationales, focusing on why answers are right or wrong. Break down large content into daily study blocks instead of long, exhausting study sessions. Break content into focused 45 to 60-minute blocks with short breaks. Example nursing study schedule. Monday. Cardiovascular system, hypertension, MI, CHF, 1-hour study plus 30 practice questions. Tuesday. Pharmacology, beta blockers, ACE inhibitors, flashcards plus clinical applications. Wednesday. Maternity nursing, stages of labor, fetal monitoring, case study discussion. Consistency is the key. Small daily reviews prevent the need to cram before exams. Keycap 3. Understanding over memorization. Think like a nurse. The N-Klex and nursing school exams don't just test what you remember, they test how you think. Here's how to shift from memorization to understanding. Use concept mapping. Instead of memorizing isolated facts, connect topics together. Example. If you're learning about heart failure, link it to pharmacology, diuretics, beta blockers, pathophysiology, fluid overload, and priority nursing interventions, daily weights, sodium restriction. Practice clinical judgment. Ask yourself, what will I do for this patient, instead of, what does my textbook say? This is exactly what the next-gen N-Klex, NGN, now tests. Think in terms of patient outcomes. Instead of memorizing a drug's side effects, ask, 1. What should I monitor for? 2. What patient teaching is required? This way, you're not just memorizing, You're learning to think like a safe and competent nurse. Keycap 4 applies smart test-taking strategies. Even if you master the content, you still need effective test-taking strategies to succeed in nursing exams and the N-Klex. A. Use the ABCs and Maslow's hierarchy for prioritization. Checkmark. Always think. Airway, breathing, circulation, ABCs. What's the immediate life-threatening issue? Checkmark. Apply Maslow's hierarchy. Physical needs come before emotional or psychosocial needs. B. Read the entire question and look for clues. Identify keywords. Most important, first action, need for further teaching. Look for eliminators. If two answers say the same thing differently, they're usually both wrong. Avoid distractors. The N-Klex often includes answers that sound good, but aren't the priority. When in doubt, always choose the safest nursing action based on patient safety guidelines. Keycap 5. Balance self-care with effective study habits. Nursing school is challenging, but burnout will only make it harder to retain information. Research shows that chronic stress reduces cognitive function and memory retention, so self-care is essential. Tips for managing stress and studying effectively. Get enough sleep. Sleep is when memory consolidation happens. Stay active. A short 20-minute walk boosts focus and memory. Use mindfulness techniques. Deep breathing or meditation reduces exam anxiety. Study in a distraction-free environment. No social media, no interruptions. Remember, taking care of yourself is just as important as studying. It helps you perform at your best. Bullseye. Conclusion. Your path to success starts today. Success in nursing school isn't about how much you can memorize. It's about how well you understand, apply, and retain information. By using active learning strategies, spaced repetition, clinical reasoning, and test-taking techniques, you're not just preparing for an exam. You're preparing for a career where critical thinking saves lives. So, here's your challenge. 1. Ditch the cramming. 2. Adopt active learning strategies. 3. Think like a nurse, not just a student. Start now. Be consistent. Trust the process. And most importantly, believe in yourself, because you're not just preparing for a test. You're preparing to be an exceptional nurse by passing your board exam with confidence. Thank you for your dedication and hard work. Keep striving for excellence.